Hi, I'm Dr. Jenny Chang. I made this video to educate our patients about the importance of treating ADHD related problems and why, as a dentist, that I can help. So I will introduce to you a special friend, Melissa. She came to me when she was 7 years old. She had a hard time understanding what she wrote down. She would tell me, I can't understand what I wrote. She's falling behind at school. Her teachers thought she had ADHD problems, and really her parents were told to have her start taking ADHD related medication so she can focus at school. So I will let Melissa tell you her story. What's your name?
My name is Melissa. My last name is Soros.
All right. So I'm gonna ask you some questions today, okay?
I actually want to show you that a test, and I got 100.
Wow, that's fantastic. Can you read that paragraph to me? Remember you said
this one?
Okay, so I'm gonna remind you, like when we first met. Remember you had a real hard time reading and writing what you wrote?
Yeah.
So you told me, like, I don't understand what I wrote, right?
Yeah.
Okay, so now
And now I can read what I said. I said, one of the same thing is that they are both very violent storms. The thing that is different is that tornadoes are funnel-shaped.
we also have a special recording.
Alex.
Let's listen to it together.
Good afternoon, Mrs. Soros. This is Mrs. Moore, and everything's fine. I'm just calling to let you know that the results of the language testing came in, and it's very good. She has no language difficulties. I have a copy, then we'll move on and see what else we need to do. Thank you.
So this view, we can see that when the jaw is too small, not wide enough in this dimension, you can see the canine is about to coming kind of sideways because there's just inadequate room, insufficient room. This is a permanent adult central incisor, lateral incisor. So a child at this age, sometimes from 7 to 9 years old, this is the space that we need to increase in order to prevent the impaction of the canines. So in this view, we can see this is a child's face, this is the nose, the lips, the teeth inside, this is the front, this is the back of the head. So a child with really large adenoid tissue. Okay, so in the frontal view, we can see this is all adenoid tissue. So this is about at least 50% blockage of the upper airway. So the air comes through the nose going down. So this area is very small. So the other area makes the airway very small is the oropharyngeal airway, this area through the mouth. So with the snoring, it's going to make the uvula tissue elongated and thickened, make this area of the airway very small, plus tonsils here. So we can see the very large tonsillar tissue. If I move the slide a little bit to the side, you can see the size of that tonsil right there. So in this anatomy view, it shows you the location of the upper airway, nasal cavity, nasopharynx, oropharynx, and hypopharynx. This is the tongue, this is the teeth. So if there is enlarged adenoid tissue right here, which is really close to the ear canal right here. So that's why I talk about when a child has a really enlarged adenoid tissue, it becomes really hard for them to focus and hear, and that will affect their auditory learning.
It was a big life change for Melissa as well. Now she does much better in school and she's sleeping very well. And I'm very happy that I don't have to give her any medication. Very thankful and I'm very grateful. And I'm very happy that Dr. Chang was here to help me out.
As you can see, this is a complicated process to go through. Thank you, the Source family, for sharing their stories. Family cooperation is really important for achieving successful outcome. I hope you find this video helpful and let us know how we can help you.